Temperature monitoring is an essential component of patient assessment. By choosing the new Filac 3000 EZ Electronic Thermometer, you have selected a fast, highly accurate, and simple-to-use clinical instrument used for measuring patient temperature by oral, axillary, and rectal means. The Filac thermometers, with proper care and use, will provide years of precision service. The Filac EZ Electronic Thermometer takes accurate readings in less than 4 seconds. The thermometer is an icon-based device with easy-to-read symbols that indicate thermometer mode, functions, and status. All icons are displayed on a large display, which is backlit for easy viewing in low-light conditions. Additional features of the Filac EZ Thermometer include an auto-on when the probe is withdrawn from the probe well, and auto-off when the probe is returned to the probe well. This helps to conserve battery life. There are also 2 battery indicator icons, one for low battery and one for dead battery. The battery should be replaced if either icon appears on the screen. When taking a patient's temperature, begin by ensuring the isolation chamber is attached. Remove the probe from the isolation chamber. This will automatically turn on the Filac EZ Thermometer. Probe covers are conveniently stored on top of the thermometer. A new box contains 20 probe covers. Insert the probe into a probe cover. Push the handle of the probe down firmly until you feel the probe cover snap into place. An icon identifying oral, axillary, or rectal mode is displayed. The rectal icon cannot be displayed when a blue isolation chamber and probe is attached. Conversely, the oral and axillary icons cannot be displayed when a red isolation chamber and probe is attached. To take an oral temperature, use the blue isolation chamber and ensure the thermometer is in oral mode. To change the mode, press the sight button to toggle between oral and axillary modes. Insert the probe tip deep into the sublingual pocket next to the frenulum linguae, which is the vertical fold of tissue centered beneath the tongue. The tip may be placed on either side of the frenulum linguae toward the back of the mouth. This location is considered a heat pocket, and the probe must be placed and held here to obtain accurate temperature readings. Ensure that the patient's mouth is completely closed. Hold the probe in place until a long beep sounds, indicating the temperature measurement is complete and the final reading is displayed. To take an axillary temperature, use the blue isolation chamber. Ensure the thermometer is in axillary mode. Raise the patient's arm and place the probe tip directly against the skin in the center of the axilla, parallel to the spine. Press the probe gently in place to ensure good contact. Lower the arm and have the patient remain as still as possible. Hold the probe in place until a long beep sounds, indicating the temperature measurement is complete and the final reading is displayed. When taking a rectal temperature, ensure the red isolation chamber and probe are properly attached and a probe cover has been applied. Apply lubricant to the probe tip if needed and insert the probe into the patient's rectum, angling it slightly to ensure good tissue contact. The depth of insertion for children is 1/4 to 1/2 inch, or 6 mm to 13 mm. Insertion depth for adults is 1/2 to 3/4 of an inch, or 12 mm to 19 mm. Have the patient remain as still as possible. Securely hold the probe handle until a long beep indicates that the temperature reading is complete and the final temperature is displayed. When you have completed the temperature reading, discard the probe cover into a medical waste container by pushing the button on top of the probe and return the probe to the chamber. Document the reading in accordance with your facility protocol. The amount of time required to complete a temperature measurement depends upon the site and operation mode selected. It is a common myth that 98.6 degrees Fahrenheit, 37 degrees Celsius is everyone's normal body temperature. An individual's normal body temperature is actually a range and will vary by age, gender, and measurement site. Body temperatures also fluctuate throughout the day, and normal readings may be cooler in the morning, warmer in the afternoon, and cooler again in the evening. Normal body temperatures also tend to decrease with age. Other factors that can influence body temperature are the patient's recent level of activity, metabolism rate, medications, or disease process. Readings from different body sites, even when taken at the same time, should not be directly compared, as body temperatures will vary by site. Your patient's condition and your facility's protocol will dictate whether you should monitor temperature using an oral, axillary, or rectal site. To provide temperatures quicker than old-style mercury thermometers, most electronic thermometers predict the patient's temperature based on a sample of readings. The Filac EZ Thermometer normally operates in quick mode to provide fast predictive measurements in 3 to 4 seconds. To help reduce the chance of cross-contamination, the Filac EZ Thermometer utilizes separate chambers for oral, axillary, and rectal temperatures. These chambers ensure that oral and rectal probes and chambers are kept separately. The blue chamber and probe is used for oral and axillary temperatures, while the red chamber is used for rectal temperatures only. To remove an isolation chamber and probe assembly, grasp the isolation chamber from each side, squeeze inward, releasing the snaps, and slide the isolation chamber up to remove. To install an isolation chamber, align the probe well finger with the opening in the top of the unit, and slide the isolation chamber down until the side snaps click into place. The probe is connected to the thermometer automatically. You may view the most recent temperature reading by simply pressing the C degrees, F degrees button on the front panel. The probe must be in the chamber and not have been removed since the last temperature was taken to display the reading. Withdrawing the probe from the chamber will erase the last temperature taken from memory. The Filac EZ Thermometer operates using 4 standard disposable AA batteries. When the low battery indicator icon is displayed, you should immediately change the batteries as the thermometer has approximately 50 temperature readings remaining. New alkaline batteries will last approximately 12 months, with a lithium battery lasting approximately 2 years during normal operation. See the operator's manual for complete instructions on how to change the batteries. The entire thermometer may be easily wiped clean. Use of a damp cloth or sponge is recommended, as abrasive pads may result in damage to the thermometer. Mild detergents mixed with water may also be used. Refer to the operating manual for full cleaning instructions. Do not spray, submerge, or soak the unit in any liquid. For full instructions, please see the Filac EZ Thermometer operating manual. The Filac EZ Thermometer. Fast, accurate, and easy to use. From acute hospital settings and long-term care facilities to physicians' offices and home care, Covidion's Filac thermometry provides cutting-edge technology to meet your clinical needs.